Now, I will admit, there are a couple minor setbacks to PAD. For one, the whole concept of the practice flies straight in the face of the unspoken rule that medical officials should not knowingly or willingly harm a patient, and doing so will undermine the unspoken trust between medical official and patient. Additionally, PAD could be used as a get out of jail free card towards tough and or expensive medical operations, particularly those performed on more gullible or mentally impaired patients. Now, admittedly, those are setbacks. But I think the pros of PAD drastically outweigh the cons. Well, what are those cons, you might ask? Well, I think it boils down to three things: the moral pros, the economic pros, and the work efficiency pros. Starting with the moral pros of PAD, starting with the moral pros of PAD, it is humanly wrong to keep a patient who is terminally ill and or suffering from immense pain from ending their own life if they wish to relieve the pain. I mean, come on. Look at these people. See the amount of pain they're in? See the sadness on their faces? Do you really want to allow their pain to go on and on? No. No, you don't. That's why they should be allowed to end it if they wish, no matter what the means of ending is. Additionally,
Now just hold up there a second, Dylan. Now just hold up there a second, Dylan.
Whoa, wait a minute. Who are you?
It is I, David, your edgy anti-PDA rival.
Oh yeah, I was wondering when you drop in uninvited again. Ugh.
Yeah, whatever. Enough of the introduction. Now listen here, you lot. Do not listen to whatever that chump has to say. He is lying to you. Everyone knows that physician-assisted death is just an overly elaborate way for doctors like him to get out of a heart operation, and the whole concept itself is just morally wrong. According to various medical ethical codes like the Hippocratic Oath and the American Medical Association Code of Ethics, it is morally wrong for a medical official to knowingly harm, or worse, kill a patient, as that just undermines the trust between patient and physician.
Now, my dear friend, slow down. I do get where you're coming from. However, what you said does not really apply to PAD. It more or less applies to euthanasia.
Euthanasia? What's that, Mr. Smarty Pants? Some country in between Asia and Europe?
Euthanasia, for those who don't know, is the act of killing of a patient using a lethal injection or something like that.
So what? That just sounds like PAD with a more stupid and nerdy sounding name, man.
No. God, no. Despite their similar outcome, PAD and euthanasia are very different beasts. Whereas PAD is pretty much always done with the patient's consent and consideration in mind, euthanasia is basically just putting your dog down, albeit done on a human. The patient gets no consent and no consideration, and the medical official directly kills the patient. Euthanasia is morally wrong and can easily be abused. Meanwhile, PAD, lots of consideration and planning, on top of the consent of the patient and their families, are taken in to ensure that it is truly what the patient and their family want. Additionally, the medical official never actually directly kills the patient. They are simply providing the tools to kill the patient, and the patient carries it out on their own accords.
But the medical provider, he's still knowingly harming the patient, albeit indirectly, of course.
Yeah, that may be true. Do you know how you quoted the American Medical Association Code of Ethics? One of the most recognized medical ethical codes?
Oh yeah, why'd you ask, punk?
Well, my dear friend, it has this to say. A physician shall be dedicated to providing competent medical care with compassion and respect for human dignity and rights. Additionally, the International Code of Medical Ethics, another widely respected medical code of ethics, says the following: respect a competent patient's right to accept or refuse treatment. Look, buddy, as hard as it may sound to accept the fact that one must harm a patient, a medical official's utmost concern should always be the needs of the patient in helping them in any means necessary, even if that unfortunately includes potentially harming or killing the patient. All in all, patients should be allowed to end their own lives if they choose, as not only is it morally wrong to prolong their suffering, but it is also the medical official's job to make sure the patient is happy and their needs and cares are provided upon, even if the outcome isn't so pleasurable.
Okay. Got me there. The rest of PAD isn't much better. It's horrible.
Oh, shut up, David. I've had enough of your bickering today. Get out of here.
Wait. Don't cut me off, man. I still got more to say.
And about time I got rid of him. I didn't think he'd ever shut up. Now we get into the economic pros of PAD.